The sun set several hours ago, but Sunny the golden retriever needs help.
When I returned home from work, I bent down to pat her head, and my hand was just full of blood.
Kimberly says she called her regular vet in Gibson County, but was unable to reach them, so she made the hour-long haul here to the Pet ER.
You have any idea what happened?
The dog that she plays with, she just gets a grip on her head.
We'll get it cleaned up and then we'll talk again.
Dr. Luke Wagner is one of the 2 regular veterinarians here at the Pet ER. He and Dr. Eric Renshaw take turns working from 6 at night to 8 in the morning, a weekly graveyard shift to take care of your pets.
It's a win-win situation, I think, for clients and the veterinarians.
Here we go, General. Private practicing is more preventative health, vaccines, elective surgeries, whereas in emergency practice, we're dealing with a lot of critical patients. There's really no predicting what's going to come in off the street. As you can see, he suffered a lot of trauma to the head.
While there's no predicting who they'll treat, there's also no pattern to when they're busy. This particular night, 8-week-old General is the lone ranger at the Pet ER. But on another night, there are several patients.
It's all right.
Sharon Ray brought in 14-year-old Greystoke because she says he was having trouble breathing.
Didn't feel well, I can tell. And so I thought I better bring him down here and find out what the problem is. Our regular vet, of course, they're closed tonight.
I took some chest x-rays and probably had a little bit of a heart problem, but we're treating him symptomatically.
Yeah. Did you feel better? He's ready to go.
No sooner than Greystoke leaves, Sunny comes in, and this time the doctor says surgery is required.
People are on edge, the animals are painful.
It's not uncommon for us to cry sometimes with the client, because they can tell what they're going through. We placed the drains, and sutured the area. We did end up putting an e-collar on, Elizabethan collar, to keep her from pawing at her drains.
Oh, honey, it's time to wake up.
Members of the staff here at the Pet ER say they see about 70 patients come through these doors every week. And in about half of those cases, it's the patient's first visit.
Actually, I didn't know about it. My daughter has had her animals here, and she told me.
I was very, very surprised. I knew that this type of facility was not available for me in Gibson County. So she's worth it to me to hop back in the car, drive another hour back to Evansville, and get her the treatment that she needed.
At the end of the day, or night in this case, both doctors and their staff say the gratitude they receive makes all the broken sleep worthwhile.
Thank you so much.
You're
I
welcome.
appreciate it.
For the most part, people are very gracious and happy that we are open at odd hours.
It doesn't have to be coming back from the brink of death, to saving them. You can always tell that people just are very appreciative that we're here.